In selected cases where replacement of missing tooth is not possible by a removable denture or a fixed bridge, an implant is suggested. An implant is a stump embedded in the jawbone to support artificial teeth. It is made from special metal called titanium, which gets fused with bone and acquires a firm grip. The procedure of implant is conducted under local anesthesia. An incision is made on the top edge of the gums and the ridge of the jawbone is opened around the site of the implant. With the help of special drills, a precision hole is made within the thickness of the bone for each implant. On fitting the implant into the hole, the gums are sutured back. Once accepted by the body, the implant becomes part of the bone and creates a strong support for fixing a bridge. The replaced teeth can now be used for chewing food in the normal way.